Welcome to Doctors on Call. I'm Jenna Miller. A short time ago, reports from the Center for Disease Control had stated that flu cases may have peaked nationally. At one point, all of the contiguous United States was classified as high activity. Here in Kansas, flu-like illness was very common and on the rise. This year's deadly flu season started early, and it has been the worst since the 2009-2010 pandemic caused by the swine flu. Influenza is our topic tonight on Doctors on Call. Joining us will be Dr. Lynn Fisher and Dr. Michael Aller to answer your questions.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Influenza is our topic this evening on Doctors on Call. Give us a call at 1-800-337-4788 toll-free with your medical questions about the flu on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician. Dr. Lynn Fisher received his Bachelor of Arts degree in Human Biology from the University of Kansas. He received his Doctorate of Medicine from the University of Kansas School of Medicine and completed his family practice residency at North Colorado Family Medicine. Dr. Fisher is a physician owner of Lifeline Family Medicine and is on staff with Rooks County Health Center and an affiliate staff with Hayes Medical Center. Dr. Michael Aller received a Bachelor of Science degree in biology from Fort Hays State University, his master's in public health from the University of Kansas, and a doctorate of medicine from the University of Kansas School of Medicine. Dr. Aller completed his family medicine residency at Wesley Medical Center in Wichita and is a physician owner of Solomon Valley Family Medicine. He is on staff at Rooks County Hospital and a hospital board member, as well as head of EMS services in Rooks County. Give us a call again at 1-800-337-4788 if you have any questions about our topic tonight, which is influenza. Let's go ahead and get started with some of our questions. There's a lot to cover. Let's first talk about the different types of influenza there are.
Sure. Generally speaking, there are three types of influenza. There's influenza A, B, and C. If people have heard about H1N1 or H3N2, stuff like that, they're generally referring to the A strain. A and B tend to be the ones that the CDC and the World Health Organization focuses on when they make flu vaccines. C is generally doesn't get as much press as A and B do.
Okay. Is one worse than the other?
Generally, A is the one that can cause quite a bit of virulence or a viral strain that causes a lot more symptoms in humans. B and C, B is still, it can be pretty serious. C causes mild symptoms and is generally more like a cold.
Okay, now you hear of influenza, you hear people just say flu, and then you hear the stomach flu. Is it all kind of combined, or?
No, they're separate. So influenza is a respiratory illness. So when people get influenza A or B, they're going to have abrupt onset of cough, fever, headache, those types of symptoms. The stomach flu, we call it the stomach flu, but it's really likely a gastroenteritis. So you have inflammation of the stomach that may cause vomiting, diarrhea. That can be caused by viruses. Sometimes it can also be caused by bacteria, things like Salmonella, Shigella, Campylobacter. And then also there's things that parasites, like if people drink stream water, lake water, things like that, you can get parasites that can also cause diarrhea. So stomach flu is more GI and influenza is more respiratory.
I think it's really important to note with that question is that the flu shot is specifically should be called the influenza vaccine, and it's targeting just the virus that causes the respiratory problems, not the stomach problems.
Okay, very interesting. We're going to go to the phone lines right now. We've got a caller waiting to ask a question. This is Normie from Russell. Hi, Normie. Go ahead with your question for our guest tonight.
Okay, I was sick earlier in the beginning of February, and they tested me for influenza, and I had influenza B. And that procedure was about one of the worst experiences I think I've ever had in my life, them sticking it out of my nose. Is there any other way to get tested for influenza? And then once I had influenza B, could I get that again, or am I clear and safe from not ever having that again?
Okay, there are a couple questions in there. One, I agree with you that the flu swab is generally uncomfortable. That swab goes in a little further than you think it should, and usually by the time you realize it's in too far, it's over. The problem with the flu swab is that the rate of detection on the flu swab, the rapid one that you may have had done at the hospital or in the clinic, is not exceedingly high. There is a better test, which is called a PCR test, or a polymerase chain reaction test, that they do against specifically the RNA for flu, and it is quite specific on what kind of virus you may be you may be infected with. As far as could you get infected again with influenza B, sure you could. Probably not in this season or the next season, but the immunity to influenza just doesn't stick around in humans all that long, which is why we have to get vaccines every year.
And she had influenza B, so if she got exposed to a strain of influenza A, she could also, in the same season, have two different types of flu.
Okay, so we're talking a little bit about the vaccines. How do the vaccines cover both A and B, or how do you know what it's going to cover or what it might not?
In general, the World Health Organization, in collaboration with like the FDA and the CDC, will make recommendations on which strains certain parts of the world should be vaccinated against, and they have formulas for that. Part of the formula for North America is they look at the way influenza came up through South and Central America. That's part of the equation, but since there's so much international travel, it's a little more broad than that. But like, for example, this year's flu vaccine included 2 vaccines for influenza A, specifically H1N1, which was the bird flu, and H3N2, which is the Hong Kong flu. And that's the one that has made this season particularly bad. This year's trivalent vaccine also had an influenza B. It usually has at least 2 A's and a B.
Now, if somebody is completely opposed to getting their vaccine, what kind of advice would you give that person? What they can do to prevent themselves from getting the flu?
Yeah, besides living in a bubble, I mean, because you're out in grocery stores, you're in churches, you're, at community events, and the thing is that somebody can be carrying the flu virus and not even exhibiting symptoms of it yet and be contagious. So, I mean, if you're not going to get the flu vaccine, just basic things like, lots of good hand washing, or if you don't have access to that, using, the alcohol-based gels, trying to really avoid touching your nose and your mouth, without washing your hands first. Obviously, if you know that somebody is sick, you want to keep your distance from them. That way you're less likely to get exposed to the respiratory droplets from the virus.
Sure. Now, we heard at one point that Kansas was the sickest state in the nation. I don't know if there was any truth to that, but why is that? Why do you think Kansas was so susceptible to the flu this year?
I think that Kansas is susceptible to flu and maybe other epidemic-related viruses because we have a lot of interstate commerce and travel that goes through, and then the people who live and work in Kansas get exposed to people traveling from all over the country as they go through our state. In addition to that, unfortunately, Kansas has some low vaccine problems. We are, for example, another vaccine called Gardasil, which is for HPV. We're the worst in the nation at giving Gardasil. And so we've got some work to do on education. I think that's a big one, like I mentioned earlier. I think that specifically calling it the flu shot is a little bit of laziness on a medical side. We should call it an influenza vaccine. A number of my patients don't like to get it because when they get it, they frequently will get those gastroenteritis symptoms that Dr. Fisher was talking about, and they correlate the two because we call this the stomach flu and we call it the flu shot. And so I think more education would help with that, but I think being in the middle of the country, we're subjected to everybody's problems.
And why is the flu so prevalent, or seems to be more so during the winter months?
Yeah, every virus kind of has a season. So for us here in the Northern Hemisphere, the U.S., flu season is, mainly October through March. Sometimes it could start a little bit earlier than that. Sometimes it could run a little bit later than that, like it is now. But like the Southern Hemisphere countries, their flu season is a different time of year. So and it's the same thing for other types of viruses. They have a particular time of year that they tend to show up.
Okay, we're going to go back to the phone lines. We've got Carrie on the line from Phillipsburg. Hi, Carrie. Thank you for calling Doctors on Call. What's your question tonight?
Yes, I had heard recently that getting the flu shot could possibly increase the risk for Alzheimer's with the mercury that's included in the flu shot, and was wondering if there is any truth to that.
I'm not aware of any study that has shown an association between the flu vaccine or any vaccine and Alzheimer's per se. That the problem with those two events is that the onset of Alzheimer's tends to be fairly late in life, and if a person were to get a flu vaccine very early in life, I think drawing the line between those two would be difficult. I am not aware of what mercury content there is in the flu vaccine, if there is any. The makers of vaccines have gone to great lengths to try to get rid of some of the mercury-based preservatives to make people feel a little more safe, despite the fact that some of the preservatives cycle out of the human body in about 10 days and don't stick around and cause any problems. So I wish I had a better answer for your question, but I just don't think that there's any good studies that have linked the two yet.
I agree. I have not seen anything in the literature discussing a relation. The only thing that I've seen recently has been that people who get influenza, if they have heart disease, may be more likely to, suffer a heart attack. So that's another good reason for, people with coronary artery disease to be getting a flu vaccine during the flu season.
Now, we've heard of, and sometimes you never know if it's media hype or whatnot, but we did hear of several deaths that occurred because of the flu. How do people die of the flu, seemingly healthy people?
Yeah, I mean, it depends. If it happens quickly, likely the virus just caused so much inflammation in the lungs that you had a over response from the immune system, gets overwhelmed, and you get a bunch of fluid that builds up, and you basically go into respiratory failure. So that's what happens when you hear about like seemingly healthy people who have the flu one day and then pass away the next. Another way that it may happen is sometimes people get the flu, they start getting better, but they've kind of been run down, their immune system has been run down, and then you may be more likely to get a secondary bacterial infection. So people may then end up getting pneumonia. And so sometimes then from that pneumonia, if it's not treated quickly enough, people can go on to develop sepsis, and it can lead to multi-organ failure.
Now, is it ever too late to get a flu vaccine?
No. No, it's clearly there's a season for it, and in general that season runs from, we start giving flu shots towards the end of September because it usually takes about 2 weeks before you get immunity to it. So the season itself usually starts in October and then runs through about March, although this year there seems to be a bimodal peak coming on in late March. But that's why you really, if you're going to get it, you want to try to get it in September, so you have that 2 weeks before it really ramps up and starts infecting people.
Now, there were some reports that the flu shot or the influenza vaccine effectiveness was very low this year. Is there truth to that?
Yeah, there is. I think somewhere in the 30% range, maybe as high as 39 or something, pretty low. But I think that it was actually a little bit more effective for some reason with kids who got the flu vaccine. But again, it's the best defense that we have. So the more people that can get it, possibly the more that you can, keep it from spreading throughout a community.
Yeah, this year's, again, is somewhere between 25 and 39. Last year's came in as an effectiveness of 39%. They generally want, 100% would be fantastic, but they're usually shooting for about 40 to 60%. And there does seem to be some benefit to even getting the flu vaccine. Even if you do end up getting it, it tends to shorten symptoms or decrease severity. And this year, we're at about 130 pediatric deaths that have been blamed on influenza, and 80% of those children were not vaccinated. And so kids do get it, but it may lessen the severity getting it, even if it's not 100% effective towards that particular strain.
Okay, we're going to go back to the phone. So we've got Judy on the line from Dodge City. Hi, Judy. Thank you for calling Doctors on Call. Go ahead and ask your question.
Yes. Last fall, I got flu vaccine and a pneumonia vaccine. I got them on the same Okay. Sometime later, I read that they would be more effective if you got like the flu shot and then 2 weeks later got the pneumonia vaccine. Can you comment on that?
As far as I know, there's no recommendation from the CDC or the immunization gurus, which is the ACIP, is an organization that makes recommendations regarding vaccines, that you need to separate them, that you can't give them at the same time.
Yeah, I would say that to Judy and then all the other people listening, I think this is another place where we've gotten a little lazy. If you talk about the pneumonia vaccine, which is not what we're talking about, but that is sort of specific to one type of bacteria. And so patients sometimes get that and then they still end up with pneumonia and they're very confused, and that's because lots of strains of bacteria can cause pneumonia, but we don't want you to get the one type that's covered in the vaccine. But I think that lots of people get worried about overdoing the immune system, and this is a conversation that we have regarding pediatric patients and vaccines in particular. Because parents sometimes feel like we're overwhelming the immune system, and if you look at the number of antigens, or the proteins that our immune system reacts to, children, when they go to just routine daycare, are getting exposed to 10, 15 times the amount of antigens that you get in a vaccine series. So I wouldn't worry too much about getting a pneumonia vaccine and a flu vaccine side by side, especially if you're feeling well.
Now, let's say a person gets influenza and they've either been vaccinated or not. Regardless, what do they do to try to heal up and stay away from others? Just talk about that.
So you said if they have influenza?
Right, yes.
Right, so I mean, yeah, you want to stay away from the public. You want to get lots of rest, keep yourself well hydrated. You can use medications to help reduce fever, because a lot of times just the discomfort associated with the flu virus is what really bothers people the most, is the aches and pains. That if you are seen within 48 hours, there is the possibility that you may be able to be given a medication that can help reduce the severity. But it depends, because we don't always recommend that everybody needs to be treated with the medications. There can be side effects from it and the medications, at best can maybe decrease the length of symptoms for a day. So there's a lot of things that you have to discuss with your doctor to figure out if it's the right thing to go on the medication. But when you get the flu, you're going to be contagious probably 5 to 7 days, and so definitely staying away from others, that way you're not spreading it to other people.
Okay, we're going to head to the phone lines again. We've got Carrie on the line from Sedgwick. Hi, Carrie. Go ahead with your question for Dr. Lynn and Dr. Michael Aller. Hi, Carrie. Are you there? It's Terry. Oh, Terry, are you there? Sorry. Terry from Sedgwick, are you on the line?
Yes.
Okay, go ahead with your question.
So yes.
Make sure you turn down your television and you won't get that feedback.
Yeah, I'm not getting any feedback.
Okay, go ahead with your question.
I'm just curious, you guys push these flu vaccines and pneumonia vaccines. Why is nobody talking about how many people react and have a big serious side effect, even death, from these vaccines?
I didn't catch all that.
I think she said that there's the thought that maybe people getting these vaccines are having adverse reactions or possibly dying, and we're pushing the vaccines, but yet there are people that may have these types of, and I think that, again, it's looking at the overall risk and benefits. I mean, there is nothing that we can say with 100% that there is not a possibility that there could be some sort of reaction. Now, the reactions are usually very mild. People may have a little bit of soreness at the site of the injection, a little bit of redness. You can run some low-grade fevers, feel a little achy. But tens of thousands of people die in the U.S. every year related to the flu virus. Tens of thousands of people do not get harmed from getting a flu virus. So the benefit of giving it greatly outweighs, the possibility that there are some, a few people who may have an adverse reaction, in my mind.
Yeah, most of the organizations involved in the development of the flu vaccine, that would be the CDC and the World Health Organization, and the FDA, estimate that about one, maybe as many as 2 people in 1 million will have a serious adverse reaction from a flu vaccine. And like Dr. Fisher said, every year in the United States, somewhere between about 12 and 60,000 people lose their life because of influenza.
So who might not be a candidate for an influenza vaccine?
Sure. Well, there's a couple of different flu vaccines, but the standard one, anybody who's ever had a severe reaction to it probably should not have it. Children under the age of 6 months are not ready for the flu vaccine. Anybody with egg allergies should not have the standard one, but there are alternatives to that vaccine. And then people who have had like bone marrow transplants need to have an in-depth conversation with their hematologist and their primary care physician on whether the flu vaccine is right for them.
Now, what about prevention? Besides the vaccine, is there a way people can build up their immune systems?
Well, there's, yes, I mean, diet is always a good way to make sure that you're taking in the right stuff. There are a handful of studies that link the intake of vitamin C and zinc during cold and flu seasons to help reduce symptoms. But in general, good nutrition, try to avoid getting diabetes in your life, as diabetes makes it very hard for the body to fight almost every kind of infection. Try to reduce or not expose yourself to tobacco. Those are all great ways to avoid really any infection, but particularly influenza.
And your immune system works better when you exercise regularly, when you get that 7 to 8 hours of sleep.
Okay. When might a person need to get to the ER if they have flu-like symptoms?
So, if a patient is experiencing, shortness of breath, whenever you take a big breath in, it really hurts. You have chest pain with that. Obviously, if the coloration, of a child, like if there's any blueness around the lips, if, somebody is confused, not making sense, those types of signs. Or if you were getting better, and then all of a sudden you come back with, a fever again, and your cough is worsening, that might be a sign of pneumonia. That would be a reason to also be evaluated.
And what about if you have to get to the ER? What's the best way to contain yourself, I guess, if you will, to not spread that flu once you get into the hospital?
Most hospitals, if you present with flu-like illness, most hospitals will have a sort of a mandatory mask so that we're not spreading this stuff into the waiting rooms where other people may be coming for routine visits. But in general, just avoiding close contact, staying away about 3 feet away from people, wearing masks, good hand washing.
And if a person is just not getting better, what might they need to do?
Then again, you have a visit with your doctor. You may have to have blood work done. You may need a chest x-ray to help rule out some of the more serious complications such as pneumonia. But again, sometimes no matter what we do, an illness may need to run its course. So as long as your symptoms aren't severe and people are stable, sometimes, it's just a matter of time for symptoms to improve.
Are there any foods, we were talking about ramping up your immune system, are there any foods in particular that are good in helping fight off? Of course, you might not feel like eating, but what might some foods be?
I have read, and I don't know if it was specifically to the flu or just to getting viruses in general, but things that are high in antioxidants, so like blueberries might be a good source. Things that help gut health, like probiotics, acidophilus in yogurt, things like that may also be of benefit.
Okay, now are probiotics good to, is that something that a person can take all year long to try to ramp up their immune system?
Yeah, probiotics are probably a reasonable idea for most people. I mean, you probably don't have to consume them every day, but thinking about getting them a couple times a week, whether that's through activated yogurt or just simply taking a pill with a probiotic is pretty good for overall GI health, not specifically influenza.
Okay, excellent. Well, thank you so much for being our guest tonight, Dr. Lynn Fisher and Dr. Michael Aller, for being our guest on Doctors on Call. On our next show, we'll be discussing hormones and naturopathic medicine. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.